It's Richard Finn, medical oncologist from the Geffen School of Medicine at UCLA, where I have an interest in hepatobiliary malignancies. I'd just like to share with you today a short preview of the ASCO GI 2025 meeting that's coming up in the near future, and some abstracts which caught my eye and may be of interest to all of you in the audience. Really not much practice-changing data in the liver cancer space at this year's meeting. We've had a lot of phase 3 studies read out in the past few years, which has really put a pause, I think, on the next phase of practice-changing studies as we try to figure out how to sequence things and what is the next big target in liver cancer. With that being said, there are some studies of interest, and a lot of them actually are in earlier stage liver cancers, including in that is biliary cancer. And one that I think is of interest is this study that will be presented in an oral presentation, the Accelerate trial. This is a study looking at adjuvant chemotherapy versus chemoradiation in resected gallbladder cancers. Clearly an unmet need. Currently, we often treat these patients with capecitabine based on the BILCAP studies, but we'll have to see what this study reads out. Also, I think a study that's very exciting, and actually maybe from this data we'll see a reinvigoration of the use of this adjuvant cytokine-induced killer cell immunotherapy as adjuvant therapy for resected liver cancers. A study from Korea many years ago did show a very positive readout in the adjuvant treatment of resected liver cancers with this cytokine-induced killer cells. And this study in the general session will give long-term follow-up from this randomized study and also some biomarker data. And to be honest, this is a strategy that showed that it actually worked in a phase 3 study, but never really took off. And I think that has been limited maybe by the commercialization of the approach. The initial study was an academic effort, and we'll have to see the results of this study that perhaps will give it a little more emphasis in moving this forward to a registrational approach globally. Also, in the early stage study, there's the IMULAB study that's being presented. This is abstract 582. This is looking at pembrolizumab in combination with local ablation for patients with early stage liver cancer. There are adjuvant studies of pembrolizumab ongoing, the phase 3 studies with adjuvant pembro after resection or curative ablation. And this study will add to evidence that perhaps supports that approach, though it is a single-arm study. Also in the early stage setting is a rapid oral presentation, late-breaking abstract 522. That is a randomized study looking at chemoembolization with pembrolizumab and apatinib versus TACE alone. Now, you remember that we've seen randomized studies actually just published this month in Lancet, the Emerald-1 study, looking at TACE with durvalumab and bevacizumab, as well as the LEAP-012 study of lenvatinib and pembrolizumab in combination with TACE. And we know that pembrolizumab and apatinib was a positive readout in the phase 3 CARES 310 study that looked at pembrolizumab and apatinib versus sorafenib. This regimen is not yet approved in the United States, however, has been used in China for some time. And this open-label randomized study of TACE versus this regimen will be presented, and it'll be very interesting to see if this reinforces the idea of systemic treatment in combination with TACE in intermediate liver cancer. In the advanced setting, there is really not a lot of practice-changing data. Some interesting studies in the biliary setting. There is the NEAR-B study. This is abstract 589, I believe, looking at my notes here. And this is a study looking at niraparib, the PARP inhibitor, for patients with BRCA-mutated biliary malignancies, as well as other cancer types. But the biliary cohort would be quite interesting, given that we have limited options for these patients. Two other studies in the advanced setting is the Challenge study, abstract 587. This is a multi-center phase 2 study of atezo-bev in patients with advanced liver cancer with Child-Pugh B liver cancer. As you know, all the phase 3 studies with medical treatments for liver cancer have been done in patients with Child-Pugh A. There is a knowledge gap on the safety and efficacy of these drugs in Child-Pugh B, and this multi-center study hopefully will add to our knowledge in that space. And finally, there will be updated data from Checkmate 9DW. You'll remember this study was presented at ASCO 2024. This was a study of nivolumab and ipilimumab in the frontline setting versus lenvatinib or sorafenib. This was a positive phase 3 study, improving overall survival with a significant objective response rate of around 35%. And here we'll see additional subgroup analyses from this study while we still wait to see the primary results published for peer review. So those are some abstracts that I think are of interest at this upcoming ASCO GI. I'm certain there are others that are worth looking at. Please enjoy the meeting and look for some highlights from our media after ASCO 2025, ASCO GI 2025. Thank you very much. Have a good day.